Hi, I'm Kim Schrier, and I'm running for Congress in Washington's 8th District. I got into this race for a whole lot of reasons, but the fact of the matter is I'm a pediatrician and I'm a patient with type 1 diabetes, and I have a lot to say about our country's healthcare system. When I was 16, I was diagnosed with type 1 diabetes, and I learned pretty quickly what it means to worry about health, healthcare, and health insurance. In fact, I became a pediatrician exactly so that I could take care of other kids and their families. Well, I've been working with families for the past 17 years right here in the 8th District, and I've also been working in this very broken healthcare system. Frankly, I think it takes somebody who's been working in this system to understand how to fix our system. So I'm really excited to tell you today about how I'd like to make sure that we can get affordable and accessible healthcare for every person in this country and how we can do it in a bipartisan fashion. Recently, a woman named Erin reached out to me. She's a lot like me. We were both teenagers when we were diagnosed with diabetes, and we're both in our 40s now. But there's some big differences. I've been lucky. I've had great employers, I've had great health care, and so here I am today, doing well and running for Congress. Well, she had a different path. She didn't get so lucky with her employers, and so she hasn't had the best health care. And now she's in end-stage renal disease. She's getting dialysis 3 times a week. That is a travesty. That should not happen in our country, and we should not allow that to happen in our country. Again, healthcare is a human right. Right now, healthcare is the #1 cause of bankruptcy for families in this country. Right now, people with pre-existing conditions don't know if they'll be able to get health insurance next year. And right now, prices are skyrocketing because of the attacks on the ACA. We need to do better, and we can do better. Because I want to live in a country where everybody can afford excellent care. I want to live in a country where everybody has access to affordable health care. I want to live in a country where no parent ever has to think twice about whether they can afford to take their child to the doctor. I want to live in a country where people don't have to choose between paying their mortgage or paying their insurance premiums. And I want to live in a country where people with pre-existing conditions don't have to worry that it's going to lead to bankruptcy. We can do so much better. So that is why today I'm bringing you my plan for how we can do this. Look, ultimately, I think we do need to go to a Medicare for all system. But I see patients and what they're going through, and we do not have the luxury of waiting until we have a Democratic Congress, a Democratic Senate, and a Democratic President to get Medicare for all. We need to take action right away. I can't wait, my patients can't wait. And so I'm going to bring you my plan for how we can get affordable, accessible health care for every person in this country. And my plan has 4 pillars. The first is really important, and this is how we can get everybody covered. I am presenting Medicare as a buy-in public option. That means that whoever you are, whether you're an individual, whether you're a small business, whether you're a corporation, you can either choose private insurance for your employees or you can choose to buy into Medicare. It means if you're looking to get insurance for your family and you go on your state exchange, you'll see private health insurance there and you'll see Medicare, and you get to choose which one you want. If you're a small business owner and you want to do right by your employees because you know that healthy employees are better employees, you can either choose private insurance or Medicare. This does a lot of things. First of all, it brings down prices because Medicare is an affordable option. It is such a popular program. It works well and it has a 1.8% overhead. That means that more of those healthcare dollars are being spent on healthcare. The second thing it does is it puts pressure on the private insurance market. It causes them to become more efficient, to bring down prices on their own. This is a win-win situation. I would propose letting anybody buy into Medicare on a sliding scale. That means that nobody will not be able to afford health insurance. And finally, for those who can't afford to pay anything, we'll have subsidies. I do not want cost to ever be a barrier to somebody getting health care. And that is what Medicare as a public option does. Now, the second pillar of my plan is to stabilize the ACA. Look, the Affordable Care Act was an amazing first step. It brought in protections for people like me with pre-existing conditions, brought in protections for people over 50, and it gave 26 million people the ability to buy insurance who couldn't get insurance before. That brings amazing peace of mind. But it's not perfect. Prices are skyrocketing. I have moms in my office crying because they cannot afford their insurance premiums and their deductibles. And that's why we can't wait. We need to right away bring back the subsidies and the individual mandate and the reinsurance that did stabilize the prices in the private marketplace. We need to replace all of those protections that the Trump administration has taken away. And that is how we can stabilize the market and bring prices down, and at the same time continue to protect people with pre-existing conditions and people over 50. Now, the third pillar is just the cost of medical care in this country. It is insane. We spend $10,000 per person on medical care every year in this country. They spend half of that in Canada. And you know what? They have better outcomes. We can do so much better. I don't know about you, but I sure feel it when I go to fill my prescriptions. The same bottle of insulin that I've used for the past 20 years has changed in only one way. It used to cost $40 a bottle, and now it costs $260 a bottle. And my patients, so many of them have allergies. Well, EpiPens in Canada cost $50 a piece, and here in the United States, they cost $600. So guess what? I send my patients up to Canada to buy their EpiPens. They have to get a new one every single year to have in school. This has to change, and that is why one of my pillars is taking on Big Pharma. We can insist on bringing prices down in 5 specific ways. One is transparency. When prices escalate, we need to know why. Another one is getting rid of these kickbacks that pharmacy benefit managers get for putting certain medications on the formulary and not others. Third, we need to speed the process to get generics to market. That will bring prices down. And fourth, enough with this direct-to-consumer advertising, these TV commercials trying to get you to buy more expensive, newer drugs, and also those drug discount cards that make it seem like a good deal, but really it's a terrible deal because we're all paying for the more expensive, newer, and not necessarily better medication. And last, we need to allow Medicare to negotiate drug costs. We should not be paying any more for our medications than they pay in Canada. Now, the last pillar of my medical plan is how we think about the future of medicine. Thinking about some of the big topics today and how we can address them. Now, one of those is the opioid epidemic. I hear about this everywhere I go in the district. There is no community that has not been touched by this, and 68,000 people in this country died of opioid overdoses last year. We need to take this on as a public health emergency, and we need to recognize that addiction is not a moral failing, it is a chronic disease. The fact of the matter is that 4 out of 5 times it started in a doctor's office. So it's time to address this as a chronic disease. It means investing in residency programs and fellowships that will train specialists in pain medicine and in addiction medicine. It means investing in long-acting opioids and counseling and rehabilitation that will get people back to healthy lives and productive lives. And it means making sure that we at the federal level provide resources to do this. That is what I am committed to. Another area of forward thinking is the issue of rural medicine. The 8th District has a lot of farming territory, rural lands, and we already have a shortage of medical providers in these areas. Well, we can invest in this too. Did you know that if you have rural residency programs, doctors who are trained there will stay, and that is an important place that we can invest as a country. We also need to invest in telemedicine and having alternative providers available. We need to make sure that wherever you live in this country, you can get good quality care. Next, research. Wow, our country leads the world in medical research. We do amazing things here. And the reason we do amazing things is that we have a federal government that invests in medical research. It means we need to continue from the federal level to put those dollars into the NIH and the CDC and the FDA to make sure that we have great research. It also means making sure that we continue to give grants to universities that do amazing research. The University of Washington has learned how to take stem cells and turn them into myocardial cells or heart cells. This means that in the not too distant future, we will be able to treat heart attacks by taking stem cells, injecting them in tissue after a heart attack, and regrowing healthy heart tissue. That is amazing research. You know what else it means? That all of those people on the right side of the aisle who've been fighting stem cell research forever, but who are now close to heart attack age, they might reconsider. We need to invest in this, and we need to make sure that universities know that they have reliable funding for years to come, because they need consistent funding. One more thing about research. Here I am, I'm a woman, and women are underrepresented in research. We make up half the population, but only a third of the research subjects. Many studies don't even break the outcomes down by gender, and we are different. We are fundamentally different. We experience diseases differently. Twice as many women as men get Alzheimer's disease. We respond to medications differently, and we need to know about this through adequate research. All right, the last part of forward-thinking medicine, the one you've been waiting for. Here I am, a woman pediatrician. I will be the only woman doctor in Congress. I know, that is crazy. I've been endorsed by Planned Parenthood and by Emily's List because they know I will be an absolute champion for women's reproductive rights. There is no reason that we should not have the same access to all reproductive options everywhere in this country. So I will fight the attacks on Planned Parenthood. I will fight the Hyde Amendment, and I will make sure that regardless of your wealth or your insurance, you have access to a full range of reproductive options. This is what I will bring to Congress. I will bring a missing voice, because we can do so much better. Because we can live in a country where no family faces bankruptcy because of medical costs. We can live in a country where nobody has to choose between paying their mortgage or paying their premiums. We can live in a country where no parent has to think twice before they take their child to the doctor because it might be too expensive. We can get affordable health care for every person in this country. We just have to decide to do it. So now you have my plan for how to provide health care for everyone in this country, and I am excited to take that message to Congress and to go fight for you. Thanks for listening today.